Hi everyone, I am going to do a little video today about wrinkles and about what can possibly be done to help and minimise those wrinkles. So the product that we'll mainly be discussing starts with a B and ends in Botox, but I'm going to talk to you a little bit about wrinkles first of all. So you've got really two main types of wrinkles. You have got dynamic wrinkles and you've got static wrinkles. Dynamic wrinkles are the first type of wrinkle to appear on an aging face. And by aging, I don't even mean aging, like these start to appear in your early to mid 20s. So if you raise your eyebrows, you'll be able to see that lines across your forehead appear, or if you frown, you'll be able to see you've got a line in the middle of your eyebrows. And those are what we call dynamic wrinkles because they happen on movement. When you relax your face, those wrinkles will go away. So those are the first types of wrinkles to appear on a face. Later on in the aging process, these will then turn into a static wrinkle. So a static wrinkle is a wrinkle that's on your face without doing any movement. So over time, you can imagine with loss of collagen, loss of elastin, the things that keep your skin looking really fresh, then the more you do those kind of movements of raising your eyebrows or frowning, that will actually start to stay as part of your skin. So if you look at someone with more mature skin, they will have at rest lines on their forehead. So that's a static wrinkle, and that's a more difficult thing to treat. I'm not saying it can't be treated, but usually what that needs is repetitive treatments over time to help soften and relieve that wrinkle. So you'll hear a lot of people talking about wrinkle relaxing as a preventative thing, and it can be done as a preventative thing, but I really wouldn't recommend anybody getting Botox from a young age because there's no longitudinal studies into how that would affect you in later life. So I think late 20s, early 30s is a good time for anyone to start. So the product choice for wrinkle relaxing for most practitioners is botulinum toxin. It's a bit of a mouthful, and the brands are Botox, Azelur or Bocuture. Those are your three main ones, and I would be happy with any of those being used on my own face. And the areas that can be treated, you'll hear people talk about areas. So you've got 1 area, 2 area, 3 area, 4 area. People usually go for 3 areas, which is your frown, your forehead and your crow's feet. Those are the 3 areas where you're most prone to dynamic and static lines. There are several areas that can't be treated with Botox, but I can go over that at another time. There are more advanced toxin techniques that can be used to achieve more advanced things, such as an eyebrow lift. Injections underneath the eye and between the eyebrows can help to pull up the eyebrow, giving a little more bit of an arch, which is a nice effect. You can use Botox in the perioral area, so you can actually upturn a downturned smile. So you've got this muscle here pulls down on the lips, which can get worse as we get older. Simple injections of Botox there can lift up. A dimple chin, if you go like that, you can sometimes get a pebbling effect of your chin. A little bit of Botox in there completely takes that away. You've got your bunny lines, which is the 2 lines here when you wrinkle your nose. Those can be successfully treated with toxin as well. And finally, you can do Botox on the lip, which can be used for one of 2 things. It can be a lip flip, which is into your the muscle around your lip and can cause the lip to just lift out a little bit, or else it can be slightly higher to drop the upper lip, taking away that kind of gummy smile if anyone's got a sizable bit of gum visible. So those are the kind of more fancy things that can be done with toxin. So that's just really a little bit about wrinkles and what happens as we get older, and also about toxin, because I know people want to know a bit of information about it. So let me know if you have any questions, and yes, I'll speak to you soon.